Hi, my name's Janet. I'm going to be your nurse today. Your name's Matt McGee. Do you want me to call you Mr. McGee or Matt?
Matt's fine.
Matt, okay. Today I'm going to do an assessment on you. I'm going to do an assessment on your head, your hair, your scalp, your eyes, your ears, your nose, mouth, teeth, and neck. Do you have any questions?
No.
Okay, I'll tell you every time I'm going to do something, I'll explain it as I go. Please let me know if you're having any tenderness or pain when I do this. Okay. So I'm going to go ahead and start with your head. I'm going to check your scalp. So I'm going to go ahead and I'm going to touch you. I'm just going to make sure there's no lesions. I'm going to make sure there's no protrusions, no dents, no lumps. Your head is normal cephalic. Very good. I'm going to go ahead and inspect your scalp now. I'm just looking at your scalp. Still going to touch you. Let me know if I'm bothering you. Your hair is no issues with the scalp, no lesions, no bumps, no depressions. Your hair is fine. A little balding here on the frontal area. You've been doing it for a while.
Yes.
Little gray, scattered gray with brown here. All right. Facial expression is normal for this situation. And I'm going to go ahead and now check your temporal mandible, which is, I'm going to put my hands underneath your jaw and I'm going to feel for smoothness. So I'm going to go ahead and do that now. Go ahead and open up your mouth and close and open and close. So that feels pretty smooth when you do that. Did you have any pain or discomfort or tenderness? No. Okay. I'm going to go ahead and check your sinuses. So I'm going to go ahead and first do your frontal sinuses, and then I'm going to do your maxillary sinuses. So I'm going to go ahead and push on your forehead and just, do you feel anything? Is it painful? I'm going to check your maxillary sinuses. Any pain or discomfort?
No.
Okay, good. I'm going to go ahead and move on to your eyes now. Looks like your eyebrows are symmetric and proportional to your head. Your eyeballs are proportional and symmetric. I'm going to go ahead and check your conjunctivas and your sclera. So I'm going to put my hands on your face again and pull down your eyelids, your lower eyelids, and you're going to look up for me, okay?
Okay.
Go ahead and, good. They're white, clear, moist, scattered blood, red blood vessels. Go ahead and look straight. Your iris is about 5 millimeters, smooth, brown. Your pupil is black. It's about 3 millimeters. No drainage, discharge, anything like that. Do you wear glasses?
No.
Okay. And you had your vision check when last?
Never.
You didn't have your vision check just recently when you went to your physical?
Oh yeah, I did.
And what was your vision then?
2010.
Okay, good. All right, I'm going to go ahead and check it's called confrontational test, and it's where I'm going to check your peripheral visual. So I'm going to have you put one on, I'm going to show you I'm going to have you put one on your eye, and I'm going to do the same. And then I'm going to put my finger out, and when I start bringing it forward, I want you to tell me now when you see it. We're going to check each side, we're checking for peripheral vision.
Okay.
All right, so go ahead and hold that up. No cheating. So I'm going to go like this, and I'm going to put my hand out. Now you tell me when you can see. Look straight ahead at me, and tell me when you... Okay, good. Let's go ahead and switch. And you say again when you can see. Okay, good. Very good. All right, the next thing we're going to do is the cardinal position. And this is going to check for muscle weakness. So what I'm going to do is I'm going to have you look straight ahead at me, and I'm going to move my pin light up and down, and you're going to not move your head, just your eyes. Okay, you ready?
Mm-hmm.
Good. Good, very good. All right, no muscle weakness. I'm going to do the combination test now. This is where I'm going to check to see if your pupils constrict. I'm going to have you look at a far distance, and then I'm going to put something in front of your face and have you change your vision to look at that close object. All right, are you looking far away?
Yes.
All right, ready? Look at this. Okay, good. Very good. All right. The next thing I'm going to do is the pupil light reflex. I'm going to see if your pupils constrict. So I'm going to shine a light in each eye.
Okay.
I'm going to kind of make it dark a little bit because it's kind of bright in here. So I'm just gonna put my hand over here. I'm gonna shine a light, look straight ahead for me. Good, pupils are brisk, red. I'm gonna do it again, but I'm gonna go like this just because of the brightness. Good, pupils react. Very good. Any questions with that?
Nope.
Okay, good. All right, the next thing we're gonna do is I'm gonna check your ears. I'm just gonna look at your ears. They look like they're symmetric. They are a consistent color of your cheeks, which are rosy, pink. Any hearing difficulty in either ear?
No.
Okay. Skin's intact, no lesions, no lumps, no drainage. Very good. All right. And your auditory, I'm just going to look inside here and drainage. No tenderness when I touch your ears?
No.
Okay, good. All right, good. Very good. I am going to do a test called the whisper test. What I'm going to do is I'm going to take my one hand and kind of mess with your tragus and kind of irritate you a little bit, and then I'm going to come on this side and whisper, and you let me know if you can hear me. I'm going to do it on each ear, okay?
Okay.
All right, you ready?
Mm-hmm. Mm-hmm.
Good. I'm going to do the other side.
Mm-hmm.
Okay, good. Very good. All right, doing okay?
Fine.
Good.
Thank you.
All right, I'm going to move to your nose next, and then your mouth, and then we'll do your neck last.
Okay.
So your nose, and of course your throat, but your nose, it looks like proportion to your face. I see no lumps. I'm going to touch your nose. Any tenderness when I palpate it?
Nope.
Are you able to easily breathe in and out? Okay, I see no drainage. Good. Go ahead and say ah. I'm just looking at your teeth. A little discolored. I see you have an upper partial denture.
Uh-huh.
All right. And your gums are good and pink and moist. Your tongue is pink and moist with kind of rough skin. Can you look up for me? I'm going to shine a light in your mouth and look at your palate. Good. A little, well, partial, so slightly pink, pale pink. I'm going to look at your uluba. I always say that wrong. And then check for a gag reflex. And I'm going to check for your tonsils. Do you still have your tonsils?
Yes.
All right. Just say ah. Say ah. Good. Tonsils are present. Uluba looks pink, intact, no lesions. Good. Very good. All right. Was that uncomfortable?
No.
Sorry about that. All right. I'm just going to go ahead and check for your throat now. I'm going to feel on your trachea. I don't feel no lumps. Any tenderness?
Nope.
Good. Great. All right. So your neck, I'm going to go ahead and actually I'm going to feel for your thyroid gland right now while I'm right here. I'm just going to go like this. Go ahead and can you swallow? Swallow again. All right. I don't feel the thyroid gland. Okay, good. Now with your neck, I'm going to have you do a little bit of range of motion. Can you just look each way, down, up? Any discomfort or tenderness? Good. Range of motion looks good. Now you have 10 different lymph nodes, so I'm going to check them. I'm going to check, this is called the pre-auricle, and the post-auricle, and the occipital lymph nodes, with the submental underneath here, the submandible, the cervical, deep cervical, or jugular, I'm sorry, then the deep and superficial, and then your clavicle. Good. Lymph nodes, no swelling, did not feel anything, that's good. Did that hurt or any tenderness?
No.
I didn't feel no lumps or anything. Let me think. I think that's it. Do you have any other questions for
No.
me? Okay. All right. Thank you. Go ahead and turn that off.